I think the most important thing for people to understand is as the Congress heads toward a climax in the health care reform debate, probably in November, there are three huge forces converging that are going to determine whether we get a health care bill and what it looks like. The first is the Democrats are absolutely convinced they have to get health care reform done. The President, the leadership in the Congress, Speaker Pelosi, Senate Leader Reid, they are absolutely committed to getting this thing done. And if they can get it just close enough, they'll drag it over the finish line. There's a sense of inevitability. The Democratic Party's been trying to do this for 75 years. This is the time. They're going to put every resource into this. That's one of the incredible forces converging here. The other force that contradicts that is there's a lot of unease and anxiety in the country about this. If you look at the public opinion polls, the country is at best evenly split, and many of the polls show that the approval rating for the Democratic effort on health care is in the 42, 3, 4, 5, 6% range. How do you do something as big as health care reform that's going to change 1/7 of our economy and the way we all get health care? How are you going to get that through Congress if you don't have public support? The third incredible force that's coming together here is that the Democrats really haven't figured out how to do this. In particular, they haven't figured out how to pay for it yet. They've put a number of taxes on the table. Any health care bill is going to be paid for about half with provider cuts, doctor, hospital, insurance company cuts, and it's going to be paid for half with tax increases. And we're talking about $500 billion of taxes. And every time they put a tax on the table, it runs into some very firm opposition. So there's no clarity yet. It's not obvious where the other $500 billion comes from. So those three forces, the intensity on the part of Democrats to get it done. Now is the time. We have to get this done. The other force being the anxiety in the public. And the third force being where does the money come from? Really create an up-in-the-air kind of situation here, and it's going to make for a fascinating few weeks.